Good afternoon, everyone. Thank you so much for joining us. We are very glad that you are here. My name is Kelli VanderWielen. I am the Community Engagement Coordinator at Network Health. And again, we're really glad that you could join us for this educational event today. Before we get started, I just want to remind everyone that the information provided in this webinar today is not intended for the purpose of providing medical advice. All information, content, and material is for informational purposes. And this webinar may be recorded and may be redistributed by Network Health. So today we have two very special guests with us from Network Health to talk about healthcare fraud. They'll help us better identify what healthcare fraud is and also how to protect ourselves and our families. All right, so we've got a wonderful event schedule for you today. First, I will share information about Network Health, and then I will introduce Angie and Josh, our special guests. From there, Angie and Josh will share information and help us better define healthcare fraud and how to protect ourselves. They'll also give you insight on who to contact if you or someone you know suspects fraud. We will then have time to answer any questions that you have. All right, so let's jump right in. Today's event gives us at Network Health the opportunity to connect with you and support one another along our health and wellness journeys. Whether we're in a virtual room like today or at an in-person event, our connection with our communities is very important. For 4 decades, Network Health has established strong roots throughout Wisconsin by putting our members first. We are co-owned by 2 high-quality healthcare systems, Freighter Health and Ascension, Wisconsin. And at Network Health, we take the extra steps to make health insurance affordable and understandable so our members can make the very most of their coverage. Each day, Network Health and our employees improve the lives of local business owners, individuals, and families as we pursue our mission to create healthy and strong Wisconsin communities. We put in this extra effort because we want to and not because we have to. So again, I'd like to thank you for joining us and for choosing to spend time with us here at Network Health today. All right, so next I have the pleasure of introducing you to 2 of our wonderful employees here at Network Health, Josh and Angie. So Josh and Angie, I'm going to turn things over to you at this point, but if you both want to just take a second to introduce yourselves and tell us maybe a little bit about you, that would be fantastic. Angie, I'll turn it over to you first.
Sounds good. Thank you. Good afternoon, everybody. I'm Angie Keenan. I am the compliance officer for Network Health, and I'm very excited to partner with Josh today to bring you this presentation.
Great. Thanks, Angie. Hi, everybody. Josh Weisbrod.
Yep.
So, Kelly, if you want to move to the next slide, we can get started.
All right, great.
So I'm going to go through a few things on what fraud looks like, basic definitions, what you might be seeing in the community, and then Angie's going to walk through how you can protect yourself and some key contacts that you might want to reach out to in case you suspect fraud. So if you look at the slide on the screen now, you can see that fraud is when anyone intentionally provides false information to obtain healthcare services, benefits, or payment from a healthcare perspective. So if you look at the slide, there's 831 criminal cases alone in 2021, with 805 civil healthcare fraud cases opened by the Department of Justice. So fraud is obviously a significant issue that we are concerned about. We're trying to protect our revenue and your payments. So Kelly, if you want to move to the next slide. So typical types of fraud that we see here from a provider standpoint, there are things that you might see on your statements, your EOBs, would be double billing when a provider actually submits for multiple claims for the same service. Potentially phantom billing, you might see a charge on one of your EOBs or a billing statement that is something that you never received. They might also unbundle their charges. So instead of submitting a single claim or encounter for, say, a surgery that you might have had, they might unbundle those services and submit separate claims for each one of the things that they provided. They might also upcode. So they might also send you or us codes or claims for things that were not done or not coded correctly. Sometimes it's an actual honest mistake. Sometimes it's fraud. If you look at the bottom here, fraud that you might encounter as a patient or individual, is bogus marketing, identity theft, which obviously has been in the media quite a bit, and then potentially impersonating a healthcare professional. This is something we don't see very often, but you do have to be careful if someone is offering to provide you with medical services of any kind, to make sure they're a trusted source and a credentialed provider. So, Kelly, if you want to move on to the next one. So this is something we've seen quite a bit recently, and I'm guessing that you've all seen it too, particularly if you have a cell phone. So the scammers that are out there have really become adept at making their scams and their phone calls to you look like they're coming from a trusted partner. It could be Network Health, it could be a family or a friend, it could be just someone in your local community. I'll give you an example. So my cell phone number is a 608 number, and I get calls every single day from Madison, Beaver Dam, Columbus, that I know are scamming, spoofing, that are not legitimate. The thing that you can do that is probably the best way to protect yourself, if you don't recognize the number, or it's not from a trusted source, or you have any indication that it might not be who you believe it to be, let it go to voicemail. If it's important, they'll leave a message for you, and then you can call them back. If you do pick up the phone and you do talk with them, if they ask you for any kind of personally identifiable health information, simply tell them no. If they ask you to push any buttons to, move on to another part of the phone call or to provide information, don't do it. Just hang up. And if you're questioning the legitimacy of the call, just call the source. So call the number directly. You can go online and usually find the appropriate customer service number. And if it's a spoofing call from Network Health or a provider, if you're not comfortable calling the provider directly, you can always call Network Health. Just use the number on the back of your card, call us, and we can help you identify if that call is actually legitimate or not. So with that, I'll turn it over to Angie, and she can go into some of the ways to protect yourself and some resources that we have.
Thanks, Josh. Kelly, can you move to the next slide, please? Thank you. So as Josh told us, there's a lot of fraud going on out there, and actually it's kind of funny. I got spoofed by my own phone number one time. So it's sometimes it's fairly obvious when you're getting a call from somebody that you're suspicious of. So anytime you're getting those calls, like Josh said, make sure you have it go to voicemail or don't answer it. Don't feel pressured in answering any of their questions. Some of these bad actors can have very pushy personalities to try to get you to disclose information. So some of the ways to protect yourself is just be very careful when you're disclosing information. Just make sure that you're aware or are confident with who you're speaking with. So again, if you're getting a call from who you think is your insurance company and you have any inkling that it may not be, just hang up the phone and give them a call at the phone number that is on the back of your card. Calling them is usually an easier way. Another thing is, when an insurance company is calling you, they're always going to identify or ask you questions to verify your identity. So if somebody's just jumping into these calls and they're, asking you to provide information that you don't feel comfortable giving, don't give it out. You're better off not giving it out. Especially if you're receiving unsolicited visits or calls. Most of the time, people won't show up to your house unsolicited. They won't call you. Network Health, people like Network Health will call if there's an issue or something, but the message that they will leave will request that you call them back. It just won't be somebody calling you over and over again asking for information. Another way that you can protect yourself is just by reviewing all of your billing statements and your explanation of benefits. So anytime a claim is submitted to your insurance company, you should be receiving a document that outlines all of the charges that were received and how it was processed by the plan, and then leaves your responsibility, so your copay, your coinsurance, or your deductible. If you start seeing items on there for services that you didn't receive, or you see doctors' names that you don't recognize, that's always a good trigger to call your insurance company and start asking questions about, and alerting us, because we have ways that we can look into the claims to determine if they're actually a legitimate claim or not. Make sure that you're wary of any advertisements or promotions offering free services or items. This is a good way to get people to give out information, which can generate to false billing and billing for services that folks didn't receive. We see this a lot in, insulin, like diabetic strips, the durable medical equipment, so walkers, wheelchairs, things for your back, things of that nature. So we're seeing a lot of fraud in those areas too. So just be wary of any of those things. And again, overall, don't let anybody pressure you into either signing up for services, enrolling in a plan, giving out your information when you don't feel comfortable, because typically when you have that gut feeling, your gut feeling is right. So if it doesn't feel right, just feel free to end that conversation or that phone call. Next slide, please. So never sign blank forms. So this is a good one. You know, make sure that you are fully aware of what you're signing. Anybody who's asking you to sign documentation should be fully transparent about what it is that you're signing, and feel free to take that extra time to read it. You know, I know that we've all had those experiences at offices or other locations where, you know, they tell you that, you know, it's a standard form that you can just sign. You should always, you know, express your right to be able to review it in full before you sign anything. Make sure you're checking your bank statements for any charges, and make sure that you're checking your credit reports. Everybody's entitled to receive one free credit report from annualcreditreport.com. So, you know, I highly encourage that folks utilize that service, and you can also call any of your credit bureaus, which we'll get to on the next slide here. But don't let anybody talk you into unnecessary services. If you feel like it's something that you're questioning, be sure to question how much it costs. Why do you need it? If you don't fully understand, you don't have to consent to receiving additional services. Next slide. So here, you have many options on who to contact if you do suspect there's any fraudulent activity. So first of all, start with your insurance company. So if you notice fraudulent charges, or what you feel may be fraudulent charges, or you find something on your explanation of benefits that doesn't make sense, reach out to your insurance company. They have resources, just like Network Health does, that can utilize systems and claims review to identify instances of fraud. Additionally, you'll want to make sure that you're reaching out to the credit bureaus. So there's 3 credit bureaus: Equifax, Experian, and TransUnion, and we've provided their contact information here. They can place a fraud alert on your accounts, and so anytime there's suspicious activity on your account, you will be alerted to that activity, and it won't allow any new accounts to open or any credit checks to take place without your consent. Next slide. There's also some additional resources that you can utilize if you're worried about fraud. So the first one is the Wisconsin Department of Agriculture, Trade, and Consumer Protection. So they're really in charge of investigating telemarketing issues, identity theft, any complaints revolving door-to-door solicitations specific to Medicare. Any Medicare agent, they're not allowed to go door to door, so they're not allowed to show up to your house unsolicited. So if you're encountering those types of situations, you have the option to reach out to the Wisconsin Department of Agriculture, Trade, and Consumer Protection. If it's involving an insurance policy or an insurance company or anything related to insurance, you can contact the Wisconsin Office of the Commissioner of Insurance. So if you, for instance, feel that you are being billed inappropriately by a provider, and so you're getting charges that you don't feel you're entitled to, and you've contacted your insurance company and you feel like things still aren't moving, you have the right to reach out to the Wisconsin Office of the Insurance Commissioner to help out with that. Anything related to Medicare, you can always contact 1-800-MEDICARE. They review all things related to medical policy, coverage, billing, claims, appeals, lost or stolen Medicare cards. There's also the Health and Human Services Office of the Inspector General. So they investigate Social Security fraud and any fraud related to any federal health care program. So that includes Medicare and Medicaid. And lastly, the Federal Trade Commission. So they will often investigate allegations of any identity theft that's not related to specifically the Medicare or Medicaid program. So lots of options out there, lots of resources to be able to contact if you feel that you're a victim of fraud. But really the first stop is just, doing your own gut check and seeing if it's something that you feel comfortable with. And if it's not, you have that power to take that first step and end that call or end that interaction. But, folks like us at Network Health, we're always here to help you through that. So
Absolutely.
Kelly, I'll turn it over to you to see if we have any questions.
All right, that sounds great. First of all, thank you both so much. This is great and very, very helpful information. I know for me personally, unfortunately, we've had a lot of trips to the doctor this last year. And so just to have these resources and knowledge now in my back pocket, I'm very grateful and hoping that everyone else on the call today feels the same exact way. So yes, let's get to a few questions. So first of all, I'm curious, what would someone do if they lost their ID card, or perhaps it was stolen?
Sure, I can take that. So if your ID card is lost or stolen, you can go to the web and look up the Network Health phone number, or if you remember from the prior slides here that Kelly shared, the number is there. Call that number with Network Health, and our special investigations unit will actually put a pen on your account to make sure that none of the claims that come through are fraudulent. So we'll investigate each one of those, make sure that they're yours and no one else's. And then we'll issue you a new card, and we'll send you a letter with a lot of the information that Angie just shared about how you can protect your identity, how you might want to reach out to the credit bureaus or other folks that can help you put any other kind of pens on accounts that you might be afraid were jeopardized. And so our team will walk you through all of that. So.
Wonderful. Thank you for that. Okay, another question. What should I do if I see a bill from a provider that I do not recognize?
Yeah, I can take that one. So there may be instances, and we've probably all seen instances like that, where maybe you've had a surgery and you see a bill from a provider that you didn't see as part of that surgery. There are times where you are billed by physicians who perform services like anesthesia or radiology. So they're reading an X-ray or an MRI or something. So you don't physically see those physicians, but they still are involved in your care. However, if you are concerned about any of those charges that you see, or you feel that you're being billed by a physician that truly was not involved in your care, please make sure that you reach out to your insurance company again to have them investigate and look into those claims to make sure that they are legitimate claims.
Okay, sounds good. That's great advice. Thank you. Okay, so then in our day-to-day, our world today, we are filled with just commercials, right? They're coming at us from everywhere, whether it's from a social media channel or the TV or the radio. I'm wondering, what about those TV commercials and or unsolicited phone calls that are offering those additional services or products? How can people be prepared, and what should they do?
Yeah, maybe we can, Angie and I can take this together. So I'll take the first piece. I think, we both hit on this earlier. If you don't recognize the number, or you believe in any way that it might be fraudulent or a scammer, just let it go to voicemail, and then you can determine the accuracy of the phone call and if you need to follow up. If you do question it, you can always call us. We can help you determine if it's real or not real. And just be wary of anything that's advertised online or via commercial that seems too good to be true, because typically it would be. And nothing is really free, even though they might say it is free. Just be really cautious, and always reach out to a trusted source, whether it's us or maybe it's a family member or a provider, to ask them if this is a real service, if this is really worthwhile, something you actually need. And again, always reach out to us if you need to. Angie, anything else to add?
No, you said it beautifully. That was exactly what I was going to say. If it sounds too good to be true, it likely is. There's, nothing is ever free, truly free, right? It always comes back somewhere. So just make sure that you're very wary of anything that says, do this, take these steps, and you'll get this for free. It likely is a scam.
Okay, thank you. Lastly, I think it's important if we could just, again, have those reminders of the do's and don'ts with healthcare fraud.
Sure.
Yeah, so I can start out again, Josh, if you'd like.
Absolutely.
So again, I think we've said this several times, just be wary of anything that says it's free. So, don't accept offers for free money or gifts or free medical equipment. You can use a calendar. Sometimes that's very helpful to track your medical appointments and what those medical appointments are for. So when you do get those explanation of benefits or those statements, you can compare to your appointments, and that may help you identify if there are any additional charges or any additional services that were billed that you feel didn't take place. So sometimes those are a good idea. And also make sure, you're listening to your provider, or for any services that you're receiving. If they tell you that it's a service or an item that's usually not covered, but they know how to bill to get it covered, that should be a trigger that something isn't quite right. Sometimes providers have bad behaviors where they will submit something differently because they know they can get it paid under one way when they really should be billing it correctly, and it wouldn't be paid under the way they should be billing it.
That's great. Great advice. Kelly, I can take a few other ones. So some of the don'ts to do or to not do. So don't share your medical records with anyone. The health plan may request medical records on your behalf. Your providers have your medical records. If another provider needs those medical records, they can request those from your provider. So if anyone asks for your medical records unsolicited, please don't share those. Keep those between yourself, a trusted source, family, or obviously your payer and your provider. Also, we talked a little bit about the advertising and the commercials that you see, right? So depending on the time of year, those commercials can really be common. Please try not to be try to be skeptical of what they're offering you. And if it seems too good to be true, as Angie mentioned, call us and we'll tell you if it's legitimate service, or check with your provider. They usually know what the legitimate insurance services are, what the legitimate, if it's durable medical equipment, if it's a scooter or a back brace or something that you might actually need, they'll be able to direct you to the right place to find those things without getting scammed. And then with your Medicare ID card, again, protect that number. It's very valuable. If someone were to get a hold of that, they obviously could then impersonate you and receive services on your behalf, which you might be responsible for. So if that happens, call us. We'll help you with that. We can always work with Medicare and work with CMS to get that resolved. So those are some of the things not to do. And then Angie touched on all the things that you can do to protect yourself. So if you have any other questions, let us know.
Yeah, definitely. For those of you that might have questions, you can put those in the chat. Again, I just want to thank Josh, Angie, thank you so much for sharing this valuable information with all of us today. We really do appreciate it. And I'd also just like to thank everyone for joining us again today. It's been a pleasure spending time with you. If you do have questions like Josh had just mentioned, you can definitely ask those questions to us here at Network Health. Otherwise, we also do have a survey available at the end of today's webinar, and there is a section in there. If you have a specific question, you can leave the question. Just a friendly reminder to leave us also your email address so that we can respond to you in a timely fashion. I don't see any other questions out there. So great job, Angie and Josh. I think you've answered everything that we brought today to this webinar. So again, thank you. And on behalf of our team here at Network Health, we'd like to wish all of you a very happy holiday. And again, thanks for joining us, and we hope that you all take care. Thank you.